The panel management program is a step-by-step process that will help you use the data already in your EMR to better inform and plan care for your patients. Your PSP coach will work with you to create manageable steps to optimize your EMR data as you go through the phases of panel management. They will help you tailor the panel management program steps to your practice needs. And the panel management program is divided into 3 phases. It consists of phase 1 is empanelment, and that's where you're going to review your active patients, determine if they should be made inactive. For example, have they moved, are they deceased, or have they just disappeared? In this phase, you can also ensure that your active patient's contact information is up to date so that you can get a hold of them when you need to. The phase 2 is the panel cleanup, and that's where you're going to set up or work on your disease registry. And you're going to set up your disease registry to reflect what is important to your practice demographic. One size does not fit all. And then in phase 3 is the panel optimization. And that essentially is, now that you know who your patients are and what conditions they have, you can use your data to inform care. In phase 3, you're going to set up 5 care goals and develop an action plan to implement them into your practice. So the PSP dashboard was developed to help you work through the cleanup phases of panel management, which is phase 1 and phase 2. The code is available to all the OSCAR service providers, so you should be able to get it in your EMR, but it works with OSCAR version 15 or higher. So if you are on an older version of OSCAR, you would not be able to access the dashboard. It works with Well EMR's version and with Juno EMR. If you do have an older version of OSCAR and you still want to do panel management, we do have report by templates that we can do the searches for you, and you can still do that. You'll notice if you have the dashboard, whoops, let me get to the right screen here. This little dashboard button to the right of your administration button on your main page says that you have the dashboard. If that is not there, just ask your OSCAR service provider to install it for you. And then when you click on this dashboard tab, you get these panel management tabs that you can do. Panel management 1 and 2 and 3 are the ones that you're going to use for the cleanup. Phase 1 is panel management 1, and that's your active patients, assigned providers, contact information, and then phase 2 and phase 3 are you're working on your disease registry. The dashboard has some bulk functions built into it to help you with the cleanup processes in phase 1 and phase 2. And these include functions to inactivate multiple files all at once, assign a tickler to multiple files, add a condition to multiple disease registries, and exclude patients from the indicator list if they're on there, but they shouldn't be. And you can see on this slide, this is an example of a bulk tickler. So you can make one tickler, you can select a number of patients. It gives you a bunch of drop-down actions that you can pick, and you can add your own message. And then when you save that tickler, it will go into all the charts at once instead of having to enter it into each chart individually, which is a real time saver. So as you're working through your active inactives, if you want your MOA to call and check if any of the patients are still seeing you or if they've moved, or when you're working on your disease registry, if you want to call them in for a review of their conditions, then you can just do that very easily. So when you open the Panel Management 1 tab that we looked at a couple of slides ago, you'll see pie charts for the patients. And these are the patients that are assigned, these active patients are assigned to the user that's signed into OSCAR. So whoever you're signed in with, this is your patient panel. If you're going to have your MOA help you do some of this cleanup work, which they certainly can do, then you need to make sure that they have this change dashboard provider installed. And again, if that's not automatically done when you get the dashboard, your service provider can do that for you. And once you've got this, then anybody looking at the dashboard can switch to different providers and see what their panels are looking like. So active patients are all the patients in your EMR that are listed with a status of active. And you'll notice underneath here, it's kind of small. I hope you can all read it, but in my my how-to sheet that you can get off the website, you can see that in more detail. But it essentially splits them up into the number of active patients with no documented encounter, and that means an encounter note in the e-chart of OSCAR. It gives you the number of active patients seen within 3 years, active patients seen within 3 to 5 years, and active patients not seen in more than 5 years. It also gives you this number of no assigned primary. And this, just as a note, these active patients are the active patients for the user or the dashboard that you're looking at. The assigned primary, if you're in a multi-physician clinic, is the entire clinic. So don't freak out if you see thousands of patients in this number, because it is the entire clinic. All the other pies are for the person who signed in as the user. So this is your patient contact information. You'll notice some of these numbers are very small. This was a demo version of Oscar that I took these screenshots off, so they're not a real life patient thing. So this patient contact pie will show you patients who are missing things like phone numbers or addresses, contact information. One of the notes for this no assigned primary tile is if you do have a big clinic and there's lots of patients on here, you might want to consider setting up a provider to house them in, rather than just having them randomly as no assigned provider. So if you do hospital work or you do obstetrics and you see patients that you just enter into your EMR for billing purposes, you might want to consider making a provider for them, such as MAT patients or hospital patients. That way they can be set up in a thing, and then your MOA can also very easily review that provider. And once the billings have all gone through, then she can inactivate those patients so that they're no longer active in your system. Your choice. It's not a necessary thing. That's if it makes sense to you to do that, then you certainly can. So once you've got your pie chart up, you're going to click either on the pie chart here, or under the options menu. When you click on this, there's an option to drill down, and this will give you your patient list, which looks like this. So when you drill down, you'll see your active patients. Again, these are the patients for you. The first thing you'll notice is that it defaults to 10 entries. Every time you change your dashboard screen, it will default back to the 10 entries, but it goes up to 100. And especially if you have a longer list, it's usually helpful to change the default to a higher number. It's a little bit easier to scroll through the list rather than having to change pages every 10 patients. For looking at your active patients, I usually recommend that you sort your list by this last encounter tab. And when you click on that once, it will sort it for the oldest chart note and then further down the list to the newest one. You also will likely see some blanks in here. And the blanks are one of two things. They are either patients that when you changed to an EMR or started your EMR, they came over to the EMR and they have never been seen. So there's no encounter note. But they could also be a brand new patient that you've agreed to take on, but they haven't been in to see you for a visit yet. So just be aware of that when you're looking at the no encounters. Most of the no encounters will likely be patients you can just inactivate if you've been using the EMR for a while. But if you do have new patients, just take a quick look. You can review files of any of the patients by just clicking on this blue file icon, and that will take you into their demographic, and then you can get into their e-chart so you can review their charts. And then once you've determined patients that you want to make inactive, if you just select these little checkboxes beside the name, go to actions here, and you'll see a thing to set the status to inactive. And that will inactivate all of the charts that you've selected. Of note here, this is one of the bulk functions. If you've selected a lot of patients, if you have a lot of cleanup to do and say you've selected 100 patients to inactivate, do this at a time that the clinic isn't busy or you'll drive everybody else nuts, because it does that. This function does pull a lot of resources. If you're only doing 5 or 10 patients, it's not a big deal. But if you're doing a lot of patients, then do it at a time when the clinic isn't busy. And then once you've cleaned up your active patient list, you've looked at the demographic contact information, if you've created providers for your no assigned primary, that's all your phase 1 of the panel management program. And then you're ready to move on to phase 2. In phase 2, you're going to look at your disease registry. And you're going to go back to your main page and select panel management 2. And there's a bunch of disease conditions on there. The PSP dashboard is set up to look at 15 predetermined conditions, and it also looks at polypharmacy, frailty, and advanced care planning. If there are conditions outside of those that are important to your practice demographic, you can use a report by template searches to find and review those charts. The dashboard gives you a consider list And it pulls patients who meet the criteria that's noted in this box below the consider list. These boxes can differ. Some of the considerations can differ depending on the condition that they're looking for. All the boxes will note that there are the number with this condition, and that's based on your ICD-9 billing code in 2 or more bills. They will also note in all the boxes that you have coded the visit with this ICD-9 code. Most users in OSCAR do not code visits because it's a several click process. So we find that most users don't code visits. So for the most part, you can ignore that, but it's looking at your billing code. And then if there is pertinent lab work or a measurement like a blood pressure that OSCAR can track, then it will look for that as well and give you a list of patients. If you are not sure what ICD-9 code that the dashboard is using to pull this information, again, under options here, you will see an indicator info in that menu. And indicator info just shows you the query that OSCAR is using to pull this information. And even if you can't read all the code, which I certainly can't, you can scan through it and you'll recognize the ICD-9 code. So again, if you were using a completely different ICD-9 code that's not listed in that query, then it isn't going to pull your patients. You would need to use a report by template to pull those ones. And then it also shows you the prevalence for that condition in your practice. And again, that would give you the total patients that you have in your practice. And then this one, it's a teeny little, only a 1. So it's your total number of patients with no current kidney disease. And then you've got 1 with active kidney disease. And if you cleaned up these 3, if they indeed turned out to have chronic kidney disease, this number would increase. Same thing for making the dashboard work. You click onto the pie or you go into the options and you do the drill down and you get a list of patients. So in the drill down information, some of these headings will be a bit different depending on the condition that you're looking at. But you get your list of your patients. You can still look at their chart to review it if you need to. You can sort the columns by any of the headings. So if it makes sense to, sort of sort it by their last EGFR or their last ACR, you can certainly do that and work from the highest to the lowest or vice versa. And again, you've got your show 10 entries. If you have a long list, you can bulk that out to up to 100. You've got your actions, and under actions, when you're in the disease conditions, you have the option here. You can see you can assign a tickler, you can add them to the disease registry, or you can exclude them from the indicator results. And excluding a patient from the indicator results takes them off the list for a period of 1 year, and then their name will pop up again. The queries are looking back for billing conditions for 3 years, and for clinical conditions like blood pressures or lab results or something like that, they're only looking back 2 years. So after those time periods, it won't pull them up anyways. But if you have a patient, say you saw a pregnant patient and they had gestational diabetes, you coded them as 250, they will pop up on this list. And then you can exclude them or you can leave them on. And again, for the excluding, that's entirely your choice. If you like to have a nice clean list and everything down to 0, then you're going to want to exclude the patients that that should not be on there, that they're just on by some billing code that pulls them up. If that doesn't bother you at all, then you can just leave them sitting on the list. And especially if it's only a couple of patients, it's entirely up to you how you want to manage that list. Again, you do the same thing. You select the little boxes, and if you wanted some patients to come in for a follow-up to see how they're doing and whether or not you should assign them that condition, you can do that. Or you can add them to the disease registry in bulk if you know. If you have long lists, one of the workflows that I usually recommend is that you pick the low-hanging fruit first. So if you're looking at a list of either active patients or your list of hypertensive, consider list is usually quite large, you can scroll down that. And if you can see names that you recognize and you know those patients well, and you can just check them off and go, yes, I know they have that condition, check, 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 add them to the disease registry. It just makes your list a little bit shorter. And then you go back to your list and you start looking at the ones where you have to do a deeper dive into the chart and take a look at whether or not you think that they should have that condition assigned to them. Oops, sorry, wrong mouse thing here. And then once you've finished going through all of your disease conditions, which are on panel tab 2 and panel tab 3. Then you're going to get ready to do phase 3 of panel management, and your PSP coach will help you set up your 5 care goals and get all that information ready for you. There's one other dashboard that I like to show everybody. It's not actually part of the panel cleanup dashboard, but it's one of the advantages to cleaning up your panel. And there's this BC billing dashboard, and it's the first spot on the dashboard thing. And it will track your chronic disease management. This one, I think this one didn't have, off this test thing, didn't have any COPD, which is why it doesn't show. But if you do have COPD patients, it will show on there. And it's going to tell you things like your patients need a recall before you can bill this fee code, which means they haven't met the visit requirement. Patients that are billable have met the visit requirement and you have not billed the fee code within the past 12 months. And then it gives you a list of the patients that are up to date. So it's a nice handy little way to do it. Same function as the other dashboards. You just click on the pie chart or you use the drill down menu down here and you can get a list of the patients. In that, I didn't do a screenshot of it. It's in my how-to sheet, but you can also sort those columns by recall, and then you can assign a tickler. Please call these patients in for follow-up. The other thing it keeps a nice little handy tab for you at a glance is how are you doing on billing your health risk assessments? And right now we're not billing this telephone management fee. Not sure, depending on when the pandemic is done, what's going to happen with that. But if it comes back, there you go. You've got your see how you're doing over the year and also your message relay fee. So it just kind of gives you a glance. You know, are you remembering to bill these things? If you're full service family physicians, I'm sure you're doing the work. So don't leave the money sitting on the table. So now we're going to get into the panel management program. So the GPSC has provided compensation and credits for doing the panel cleanup work. So your family practice team can receive payment for up to 15 hours in total. And the team can consist of, so if you have your MOA going through some of your active, inactive patients, she is part of your team. So you can count your hours and her hours. The maximum for everybody working on the project is 15 hours. Physicians will receive a $3,000 bonus payment once all 3 phases are completed. And then physicians will also earn 3 main pro plus credits per hour, up to 15 hours, which is 45 credits for each phase of panel management. So that's 3 phases, 3 sections of doing this 15 hours. And then the GPSC also realized that panel management is not a one and done thing. So they've developed the panel maintenance cycle to keep your panel up to date after you've done all this work to clean it up. So panel maintenance can be done 2 times a year, and it's compensated very similarly. It's only one process. So the family practice team is compensated for up to 15 hours for each maintenance cycle. You can do it up to twice a year. And physicians, again, will earn 3 main pro plus credits per hour. Up to 15 hours for each panel maintenance cycle. You don't have to do it twice a year. If you have a fairly stable practice with not a lot of movement, you might find once a year is fine, but you are certainly able to do it and be funded. You can do it more times, but you can only be funded up to 2 times a year. So that is the PSP panel management program. And I'm now going to turn it over to Dr. Herb Chang, and he's going to talk about some more in-depth physician thing, and I believe he's also got a bit of an actual live demo for us to see how it works.